It's Tuesday. Hello, welcome back to another Toothpaste Tuesday. Today we are going to talk about Corsodyl toothpaste. Is that upside down? It was, sorry. Corsodyl toothpaste. If you guys are patients of mine, there's a good chance I have recommended this to you for short-term or long-term use. It is really widely known. They have a huge ad campaign out basically to draw all of our attention to bleeding gums and how it is not normal. So Corsodyl is a great toothpaste and we'll find out why now. I got this toothpaste in good old Sainsbury's for £3, reduced from £4, but it's really a widely available brand and toothpaste in most big supermarkets, pharmacies and online. If any of you guys have tried Corsodyl toothpaste before, you know that it has a very unique taste. This one, the ultra clean one, is a bit more, we'll say, user friendly, and it has that taste for a very good reason. It has a large proportion of salt or sodium bicarbonate within the toothpaste. Bacteria or plaque or biofilm as we call it are essentially millions of little bacteria stuck in a layer of slime. I know, cute. And the slime is like the best bodyguard ever, Kevin Costner, for plaque bacteria. It protects it against chemicals, so it protects it against mouthwashes and things like that. It actually protects it against your body as well. So whenever your body is trying to fight off plaque, it can't really get to the bacteria portion because of this layer of slime in and around the biofilm or the plaque layer. So one of the reasons that there is salt in this Corsodyl toothpaste is to allow the particles of the toothpaste to penetrate and break up that layer of slime so that your body has a better chance to fight off the plaque bacteria, and so it's easier to remove the plaque as well. Plaque's really sticky, so this helps your toothbrush clean it off more easily. So we'll give it a little squeeze and see what we think. First of all, you will see that the toothpaste is pink or this kind of putty colour, very different. Does still smell minty, but it smells slightly more medicated than your regular toothpaste would. So a little bit different than your average Joe toothpaste. So what did I like about it? If you guys are patients of mine, you'll know that whenever you come to one of my appointments, we do bleeding scores, and the lower the bleeding score, the better really. Bleeding at the gum line is not normal. Sometimes that bleeding could be gingivitis, which is completely reversible. Sometimes that bleeding could be something a little bit more sinister, like gum disease, which we need to really think about and treat professionally. So whenever I see my patients and I recommend that they use Corsodyl, they get results with it. Bleeding scores and percentages go down most of the time whenever my patients are using a Corsodyl toothpaste, and indeed a lot of my patients who have the lowest long-term bleeding scores have been using Corsodyl long-term as well. So it really does work. It's widely available, as we were saying earlier. It's very reasonably priced as well compared to some other solution toothpastes for gum problems. What didn't I like about it? If you guys have used this toothpaste, it is a very unique taste. It takes a long time to get used to it. I always have patients telling me that it tastes different. I always warn people that it tastes different before they start using it. Most people get used to the taste of it, and actually I have a lot of patients that feel that they really couldn't go back to using a regular toothpaste after using this because they find a regular toothpaste too sweet. It doesn't bother a lot of people, it bothers some people, the taste. So if it's not for you, it's not for you, but it's worth giving it a try if you do have some gum issues or problems. This toothpaste is SLS free, so it's not going to foam up too much, which we all know I'm a fan of. So there you go, there is my review of Corsodyl toothpaste, ultra clean toothpaste. In this case, it's a great toothpaste for bleeding gums. You can use it long term, it contains fluoride, and I see real results with this toothpaste all the time with my patients. So there you are, Corsodyl. I still love it. Thanks so much guys for watching another Toothpaste Tuesday, and we'll see you again soon.